thank you all so much for joining us today. My name is Shaylin Stanley, and I am the Next Generation Engagement Officer at Pathfinder International. Pathfinder is an international organization that focuses on the sexual and reproductive health and rights of communities around the world. And we have a long history of working with young people. And over the past couple of years, and especially throughout the Generation Equality Forum over this past summer, and talking with other organizations that are also working on similar issues that we've all come to the consensus that we need to continue the great commitments that were made and also continue to listen to the young leaders that were present throughout that forum and that are driving solutions for sexual and reproductive health. And so we're launching the event today, and just as the first event for many to come over the next year in providing a platform for young people. And so today, in celebration of World Contraception Day, that was also over this past weekend, we're focusing the conversation on how young leaders are driving solutions for access to contraception specifically. So we'll go into a fireside chat discussion today, and then we'll move into a panel with other young leaders. Before I hand it over to the fireside chat, I did want to note that we are having trouble with our Portuguese translation, so please bear with us while we work to solve that issue. But thank you all so much for your patience there. So now I would love to hand it over to our fireside chat with two fantastic panelists, Siva and Pauline. First, Siva Thananthiran is the Executive Director of ARROW, the Asian Pacific Resource and Research Center for Women. Siva is currently the Executive Director, and the organization is a regional partnership which works across 15 priority countries in the Asia Pacific with regional organizations and networks across the Global South. ARROW also played a leading role in the creation of the Bodily Autonomy and Sexual and Reproductive Health and Rights Action Coalition at the Generation Equality Forum in Paris. So we're so thrilled to have you and your leadership here. Pauline Garter will also join her, who is a young leader and the Executive Director of Girls Health Alliance. Pauline was born and raised in Liberia, and she's received her Bachelor of Science in Biology from the University of Liberia in 2020. She is also a Women Deliver young leader, so we're so thrilled to have her here. And she's also served as a Plan International Girls-Led Research Project leader, a chairperson of the National Children and Youth Advisory Board of Liberia, and a Girl Advocacy Alliance ambassador. So today, along with Siva and Pauline and our fabulous partners, Women Deliver, Girl Up, and Guttmacher, we're so thrilled to welcome you all here, and I'll hand it over to the both of you to get us started.
Thank you so much, Shaylin, and thank you for that wonderful introduction. I now have the mic along with Siva, and I'd like to say welcome, Siva, and how are you doing today?
Thanks, Pauline, and always a pleasure to be with you.
Thank you, Siva. I am doing fine, and I am so excited to share this platform with you, representing thousands of young people from around the globe who are victims like me due to the lack of sexual reproductive health and rights services, victims of unsafe abortion, victims of unwanted pregnancy, victims of child marriage, and you can name them all. I hope you are prepared and well seated to address our concerns as young leaders are working to promote the sexual reproductive health and rights of girls and young women. Now let's move to business. We are aware that your institution, ARROW, contributed hugely to the formation of the SRHR Action Coalition and now serve as Action Coalition leader for the SRHR Coalition. Can you tell us more about your role and your role in terms of engaging young people in the GEF accountability framework? We would like to hear from you, Siva.
Yeah, thank you, Pauline. The Generation Equality Forum was for some of us, an opportunity and a platform to talk about gender equality when the world's attention, was monopolized by the COVID-19 pandemic, right? So ARROW started as part of the Civil Society Advisory Group, CSAG, which was started up in September, October 2019, and there was a meeting of the core group of the government of Mexico, France, UN Women, and key women's rights NGOs and youth NGOs, where there were vital discussions on the themes of the conference and priorities, right? So Arrow helped craft and propose this action coalition to be formed on bodily autonomy and SRHR, which was also, strongly supported by the other feminist organizations and other feminists at that meeting. So the basis, of the work of the action coalition was for us to push the agenda on the themes that were not getting traction in the intergovernmental negotiations. And Pauline, you've also had this vast history in this movement. So you have all, I'm sure you've also experienced, right, the CSW negotiations and the CPD negotiations, where we are left fighting, for words like health services over health care, and abortion being always punctuated with a clause where, so 27 years after ICPD, 26 years after Beijing, only a handful of governments, are moving towards decriminalizing and legalizing abortion, making sure that comprehensive sexuality education is delivered at the highest possible quality. Hence, the work of the action coalitions, we really wanted to bring together a strong coalition of the committed to see how we can work together, learn from each other, and move the needle, simply because it's time. We can't be held back, set back by the uncooperative, the unwilling, the uncommitted, because I know, we all know that the demand from young people, women, girls, gender diverse persons on the ground, it's real, it's huge, and the needs need to be met, right now. So you asked me about how did we actually, involve the participation of young people. So from the beginning, as participating, as she said, we held regular updates, with partners in the region, sharing the work and the direction, the conference and the themes of the Action Coalition. And of course, we realigned and we presented back these priorities within the work of formulating the Action Coalition priorities. So we are proud to say that we work with a strong set of youth-led organizations across the region. And we have always included them in all of our processes. And even in the conference, we created space for the youth leaders from the region to speak both at Mexico as well as at Paris.
Thank you, Siva, and thank you for sharing the work that you have been doing, especially your role now as a leader for the Action Coalition on SRHR. So, you also made a very important point, talking about such critical issues like our comprehensive sexuality education and safe abortion, that there are only a few hand of governments who are really contributing to this, which I think we need to put more effort into this. And then you also talk about working with a lot of young people. But as we go through this conversation today, I would like to hear from you on how young leaders can be at the center of this, and not only at the center, but also rise up the leadership participation, because we believe that having our inclusive participation, we will all be able to achieve our goal. But I just like to drive into this whole issue of the comprehensive sexuality education. That is very important, because the issue of comprehensive sexuality education is still a major challenge for young people today. The issue of unsafe abortion, FGM, remain a huge challenge for us. And when I reflect back in 2016, when I lost my best friend to unsafe abortion, and then later losing my mom in 2018 due to a reproductive health condition, this is a trauma that I live with for the rest of my life. And we continue to lose many powerful people, many powerful young women and girls every day. But yet our leaders and key stakeholders continue to play politics in the name of tradition and religion. Now, without no disrespect to my religion, but I think that it is time that you as key stakeholders, especially leading the Action Coalition for Sexual Reproductive Health, and we try to hold our leaders accountable and key stakeholders. And moving forward, Arrow made a pretty bold and laudable commitment during the GEF Paris Forum on youth comprehensive sexuality education, advocacy to ensure access to safe abortion and to put an end to FGM. I would like to know, and a lot of us listening today, especially as young leaders, I would like to know how Arrow and other civil society organizations carrying our youth engagement as they implement their commitments.
Thanks so much, Pauline, and of course, the history of the SRHR movement, all of us are advocates and deeply passionate about this issue because our lives have been changed, right? By either losing loved ones, to either unsafe abortion, HIV, or dying a maternal death. And this is what really makes us, stick to our guns. And despite all difficulties, we try to make it to the finish line because we're carrying this flag not only for us and our organizations, but for all of these other women and these other girls who never had the opportunities or that access that we ourselves have had. So, on this case of comprehensive sexuality education, ARROW has been deeply committed to this agenda. Annually, we work in close cooperation with UNSCAP to organize the Asia Pacific Forum on Sustainable Development, the youth forums, and we bring together 80 to 100 people from the region in order to kind of formulate what the asks of the young people of the region are. This year, due to COVID-19 pandemic and us having to adopt this online modality, we actually brought together 500 young people, including 200 adolescents who normally could not attend because of the travel restrictions on adolescents, right? So, we can see that indeed, we cannot deny that young people are hungry to participate in all of these big actions which are defining their current lives and their future prospects, right, in the world. So in this, the Asia Pacific Forum on Sustainable Development is actually the regional level follow-up to the SDGs. And every year, without doubt, the call comes loud and clear from these youth groups that comprehensive sexuality education is a must, is a priority in the region. And as you have said, we have a lot of governments who are playing politics with this agenda, trying to dilute it or distill it or, pare it down to the bare basics, right, before giving it to the young people who need them. So definitely we are, with all of the youth organizations, throwing our support, throwing our skills, our strengths, and where we have resources as well, in order to ensure that this ask is amplified in all of the regional spaces. We also know that youth engagement, is not adequate unless it is meaningful, right? And that youth participation must be about participation in decision-making and implementation. So we also organize, every once in 2 years, a multi-stakeholder dialogue on comprehensive sexuality education with UNFPA and UNESCO. And we bring together government, young people, feminist organizations, research organizations, youth organizations to discuss the progress we have made towards actualizing the standards that are set out in UNESCO's International Technical Guidance on CSE. So we are also a proud partner of the Right Here, Right Now consortium, which is a Rutgers-led consortium funded by the Dutch Ministry of Foreign Affairs. And through this consortium, we have experienced and almost always created and provided a platform for young people to take the leadership of the agenda, all the way from the community level to the Human Rights Council level.
Thank you, Al. Thank you, Siva. And it's actually good listening to you sharing our different means that you are engaging young people. But you talk about a forum Al that brought together about 500 young people, and you had some challenges in getting adolescents. And this is why our such conversation is very important, engaging young people. And that's why I want to be grateful to the organizers of this forum. And I hope that moving forward and organizing such an event, it is always good to dialogue with young people and find the risks involved, the challenges involved in attending those events, because sometimes it becomes very challenging for us as young people to attend events, especially especially if you have to travel from your home country. And that's why that's one of the reasons why we also have poor representation of young people at the Generation Equality Forum in Paris. So it is our hope that moving forward, our stakeholders like you and other leaders will take that into consideration to ensure the full representation and participation of young people. And like you said, our engaging young people, ensuring that we are not only implementing, but also we are also engaged into the planning process. And as a grassroots advocate, like me and other young leaders who are working to promote the generation equality framework, the lack of access to resources and adequate funding remain a major challenge for us as young people. And that's why when you ended the statement and you said that we need to ensure that young people are at the center, I hope at this time moving forward, it is time for us to take action. Because I mean, I like to be real. If young people will continue to complain for the lack of inclusion, if young people will continue to complain for the lack of resources and support, then I tell you that we will not even be able to achieve our goal within the generation equality framework. It will not be able to achieve a lot of things at gender activities. So moving forward, we hope that your leadership and other leaders who are listening today will prioritize youth engagement, not just youth engagement, but the support of young people. And that's why I like to, with 40 billion committed at the Generation Equality Forum in Paris, what is being done to monitor funds for youth-led solution, or what more needs to be done to ensure young people are elevated as leaders? I would like to hear from you, because the need for funding and support for youth is a major call by us who are working on as leaders within the generation equality framework. So we'd like to hear from you, what is your own role and what other leaders are doing to promote youth-led solutions?
Yeah, thanks, Pauline. This was like, this is the question on everyone's lips, right? So when I go to women's rights organizations, they will ask me, where is the money for women's organization? And where is the money for youth organizations, And I think that, as we hone and refine the accountability frameworks, this is the opportunity for us to fulfill that, to make sure that this funding, a substantial amount of this funding, or a significant percentage of this funding directly reaches the grassroots, right? With no middle manager of this funds between the funder and the recipient, So I think it's really important for us to track these commitments. And in my previous experience, I have noted that, I think for access to contraception and family planning, that, FP 2030 had a great tracking system for the financial commitments made by governments, which we could adapt for utilization to monitor how governments are, where the governments are putting their money. But of course, for us as civil society and, and feminist organizations, we also want to use an intersectional process framework, right? How was the money spent? How were policies crafted? Were they top down, or was it in consultation with communities? Did we work in an inclusive manner? Did we include not only young people, but indigenous groups, people with disabilities, LGBTIQ persons, migrants, refugees? Did we do things differently from what we would have done? So some of these kind of process and outcome markers are also, I think, very essential for the accountability framework, because it's not only about doing things, right? It's about how we get those things done.
Yeah.
Important for us. So honestly, I think, you asked, what more needs to be done to ensure young people are elevated as leaders. For me, honestly, I think that definitely what we need to focus on is a youthification of the movement, to have younger people lead organizations, to be the researchers, the experts, not only on youth issues, but on all issues, to be spokespersons, program developers, program implementers, and we know that young people are searching for the space and opportunity to do so. Movement leadership means, we have to make the space for theories, theoretical frameworks, political perspective, strategic goals to be formulated and set by young people for the movement, and that time has come.
Yeah. Just before we come to the end of this conversation, you talk about some key important points, like seeing young people as experts, because most often young people are just seeing like our beneficiaries, no. But this time around, we also want to become organizers and aware as beneficiary, because I can just imagine you talking about the issue of menstruation, the issue of unsafe abortion. When our sisters, when our friends, when we are the ones struggling with those issues and better understands the recommendation, the solutions to the problem. So that's why I'm moving forward. And right now, like we said, the young people, we are already calling for actions, because there have been a lot of commitment done. And that's why we are counting on people like you as leaders to ensure that these things are done. And the need for funding for youth group, For too long, young people, we have been crying for this. We understand like some other group, sometimes they get funding, especially adults-led organizations, but most often as young people, we are limited. How long will we continue receiving $5,000, $3,000, and $2,000 grant? When will young people grow from 5,000? And sometimes those restrictions that come with those grants, because like in order for a youth-led organization to become legally registered, we need to start from somewhere. And for young people to start from somewhere, we need to have the space. So I think we need to do this together, like you said. We need to work with other-led organizations to ensure that young people are also at the center and we are all working hand in hand. So as we conclude this conversation, Siva, what message do you want to send to all SRHR youth leaders working to increase access to contraceptives and who are turning in today? And what message do you want to send the decision makers? We would like to hear from you.
Yeah, thank you so much, Pauline. I mean, like you're such a, talented and such a fiery champion, that you really kind of like, light up my brain when I listen to you. So I wanted to point out that, actually Shailene started, commenting on how that September 26th was the International Day for Access to Contraception, right? And today is September 28th, the International Day for Safe Abortion, with the theme of Make Unsafe Abortion History. Indeed, all of the data sets across the world, I mean, and when we examine the demographic health surveys, right, we know that the youngest of women face the greatest challenges in accessing contraception and safe abortion services. And as you have so rightly pointed out, these are life-saving health services for these young women, and the greatest challenges are because we have the double burden of gender and age. We live in a world where, our parents, our partners, our governments all want to have a say in who we love, who we have sex with, who we marry, and whether we have children or not, and how many children to have, right? Youth is the time, where one's sexuality is tightly controlled by all authority figures, families, schools, religious institutions, government agencies, The first step is to reclaim this body as our own, and we should have autonomy and full decision-making over this body, over all matters. And only when we have that autonomy and agency over this body can we hope to have autonomy and agency over our lives. So, and when we put this body at the center of the focus, we then understand how all the different SRHR issues cannot be compartmentalized and cannot be separated. We cannot separate contraception from abortion, CSE from cervical cancer screening, prevention, treatment, and care, or HIV from maternal health services. This body needs all of it, And at the same time, this body lives all of the global issues, right? It needs parental leave, it needs sick leave, it needs childcare services, it needs access to health insurance. This body does not live in a silo and cannot live in a silo. So we need to form solidarity across different movements, not demeaning one or elevating another, because we can only be free when all of us are free. And I think that that is the kind of message, that this last 2 years of the pandemic has taught us and driven home to us working on the ground.
Thank you, Siva, for such a wonderful conversation. It was good having this fire chat conversation with you today. We look forward to further action from you and your team. And I want you to remember, and all stakeholders are listening to this, that young people need the necessary support, resources, and funding to champion sexual, reproductive health and health issues at the grassroots level. Thank you so much for having me today.
Thank you all. Great pleasure.
Back to you, Shailene. The mic is yours.
Perfect. Thank you so much, Pauline and Siva, for the fantastic conversation. It's always such a joy and privilege to hear more about your thoughts and what you're leading around the world. And so we're so grateful to have had you here to share more on that youth engagement and more on the actions that we should be taking. So as we move into the panel, I would like to encourage everyone to continue to use the Q&A as you have questions for our panelists, and continue to use the hashtag #NextGenerationIsNow across social to continue the conversation there. But for our conversation here, I'm excited to turn it over to Charles, who will continue the conversation with young leaders in this forum around other solutions that young people are driving around the world. So to introduce Charles, Dr. Charles Otori is a senior technical advisor at Pathfinder and based in Kenya. He's a medical doctor with over 15 years of experience in reproductive, maternal, newborn, child, and adolescent health, including experience both in service delivery as well as in programming. So Charles, I would love to hand it over to you and to introduce the rest of the panelists today.
Thanks a lot for welcoming me. It's my pleasure. Good evening, good afternoon. Thanks so much for investing your time today with us. Today, we have a fantastic panel of 4 young leaders who are passionately driving sexual reproductive health and rights solutions across the world. They'll discuss the challenges young people are facing, accessing contraception, and the solutions they're implementing. The young champions will discuss with us why we still need access to contraception and essential sexual reproductive health and rights, especially during this time of the COVID-19 pandemic. Besides, we'll have conversations on what we need to be doing to move forward in ensuring genuine inclusion of the next generation leaders in policy making. This is an important topic, and the session will be interactive. We want to hear from you. Kindly type in the questions to the panelists in the Q&A. Feel free to engage also through our hashtag, Next Generations is Now. It's now my pleasure to introduce the panelists. Our first panelist is Melissa Simplicio Silva from Brazil, a Gallup leader. Melissa is a young Afro-Latina change maker, passionate about systemic changes. After personal experiences with gender inequality in her community, she began to advocate for equality, equity, finding her course in periodic poverty. Inspired to lead change, Melissa founded Cycle of Love, a Brazilian initiative that destigmatizes the taboo surrounding menstruation and sexuality by educating all genders on sexual and reproductive health and rights. She's raised over 38,000 Brazilian real in less than 1 year. Welcome, Melissa. Our second panelist is Lilibet Namakula from Uganda, a team leader, public health at the Public Health Ambassador of Uganda. She has a master's degree in public health from the University of West England. Lilibet has worked for over 7 years to impact young people's lives using advocacy, health promotion, edu-entertainment, and ICT for health. As a team leader of Public Health Ambassador Uganda, Lilibet has implemented several innovative solutions that will inform us, that she'll inform us during the discussion. Welcome, Lilibet. Our third panelist is Sarah Clifford from USA. She's Pathfinder Acacia Circle member. Sarah Clifford is a second-year Masters of Science in Public Health student at the Johns Hopkins Bloomberg School of Health with a focus in women's sexual and reproductive health and a certificate in maternal and child health. Her interests include public health advocacy, health policy, and reproductive justice. Sarah is committed to bridging her academic experience with community education and currently serves as a sexual education instructor for 8th graders in Baltimore. Welcome, Sarah. Our last panelist is Kazuko Fukuda. She's a sexual and reproductive health activist from Japan and a Women Deliver Young leader. She took a Master's of Public Health in Health Equity with a focus on youth-friendly sexual reproductive health and rights services from the University of Gothenburg. Kazuka is also a founder of a grassroots and youth-led sexual reproductive and health rights advocacy movements called #NandenNaino project, which means why don't we have in Japanese. She'll tell us more about that. She's now working especially on demanding access to emergency contraception at pharmacies in Japan with her colleagues and has collected almost 120,000 online signatures up to now. Welcome, Kazuko. I'll kick off the conversation by inviting all the panelists to tell us more about the work they are doing and what personally motivated them to become advocates in this field. We'll start off with Lilibeth.
Right, thank you, Charles, for that introduction. As Charles said, my name is Lilibeth Namakula. I work for an organization called Public Health Ambassadors Uganda. And in essence, we are a youth-led and a youth-serving organization that focuses on issues of sexual and reproductive health for young people. So we cover everything from family planning, sexual and reproductive health, menstruation, hygiene, HIV, anything under the belt, we cover. I'm so happy to be here. I think I got into the field of advocacy for young people and for sexual and reproductive health from my time doing my undergraduate course. So when we were doing our undergraduate course, we were just a number of young people that were passionate about community work. So we started out as a music, dance, and drama group that in our free time went out to see different communities and reach out and stuff like that. So from that, we were able to grow into the organization that we are today. Yeah, thank you, Charles.
Thanks a lot, Lilibeth. Welcome, Sarah.
Hello, my name is Sarah Clifford, and as Charles said, I am a current MSPH student, and I've also worked as a sex educator in Baltimore, Maryland, in the United States, where I currently live. And I think my motivation for becoming an advocate in the sexual and reproductive health and rights space really came from growing up in a state where sex education was not mandatory, and I received abstinence-only education. So as a young person, I watched as my friends and I faced barriers to receiving information about our options for contraception. So that is what got me started in this space. And I felt specifically called to help elevate the voices of young people, because I think that young people can come into the conversation and provide immense insight from their lived experiences, and also provide a fresh perspective, because I think young people can challenge norms and just refuse to accept that things just are the way that they are and they need to stay that way.
Thanks a lot, Sarah. I'll now invite Kazuko.
Hello, everyone. I'm Kazuko Fukuda from Japan. As Charles introduced me, I've been working as a SRHR advocate in Japan, and I've demanded the access to like modern contraceptive that we don't have in Japan, or like OTC use of emergency contraception in Japan. And also I translated the technical guidance of sexuality education published by UNESCO. And I've like, the reason why I really started this work is based on the experience I got when I was studying in Sweden for 1 year when I was as an exchange student when I was an undergrad. Like I was born and raised in Japan, and I never imagined that, for example, emergency contraception should be available in pharmacy for $10 or something, because in Japan, we just take it for granted that it can cost like $1,000 or $2,000, and we need prescription, or like most of the modern contraception methods are not approved to use. So like when I knew these kind of things, I was so surprised, and I felt that it's really there is an injustice, like, so I wanted to change that. So that's why I started the project called Nande Naino, Why Don't We Have? So thank you so much for having me here today.
Thanks, Kazuko. You're welcome. Now, lastly, welcome Melissa.
Hello, thank you. I started advocating for contraception in Brazil because I come from a community where many girls become pregnant by the age of 12 or 13. And seeing this lack of information among my community just made me stop and ask, why does this keeps happening? And why does anyone never says anything? And I started becoming an activist and young educator for sexual and reproductive health and rights. And I believe that contraception is public health, and this is why we should advocate for it and make sure that all people, regardless of their age, gender, or social class, should have access and knowledge regarding those informations.
Thanks a lot, Melissa. As we heard from the discussions, young people still need great access to contraception. We had the issues of what is actually happening and the challenges. But before we ask the panelists, we'd like to ask the audience, using one word, what is the most significant problem or barriers they're facing in their community? I'm sure it has been projected now. Kindly take just a minute to choose. Yes, it's Paul, choose what are the greatest.
Charles,
maybe you're muting.
I believe you
yourself,
need.
Alex?
Sorry for that. So we are having lack of information or misinformation being the majority at around 53%. And also have stigma from peers or the community. And also we have stigma from healthcare providers, that is provider bias. And lastly, issues of poor access to the health facility doesn't seem to be a major problem. But now we'll move to the panelists so that we can hear more from them. And we thank you all for highlighting some of these key problems. So we'll start with Sarah. Can you please tell us what are the barriers and what are the solutions that you are implementing at the moment?
Absolutely. And as that poll showed, I think among the young people I work with, I see a lot of those barriers. And misinformation is definitely a big one. Many people have, as I mentioned, limited understanding about their options for contraception. There's a lot of concern with the young girls I work with about side effects that they've heard about. And I think one of the best solutions to that is really just to provide better, more comprehensive sexual education. But there are also a lot of other barriers that are often beyond that individual's control. So that can be, insurance coverage, cost, the doctor, their parents. And particularly in the US right now, a large barrier is that we have prescription-only access to birth control. And the fact that there are all these different barriers on different levels is really why it's so important to get everyone involved, because we have to address each level to try and make sure that everyone has access. So one example of this is the Free the Pill movement that we see right now. There's a growing youth advocacy movement for that. And that is to have birth control available over the counter, which I definitely think is a possibility and I've hoped for, because I think back to the example of Plan B or emergency contraception, which used to require a prescription in the US. But thanks to the work of many great advocates. You can now walk into most drugstores and buy it when you need it. And I think that gives me hope that we can see the same thing happen with oral contraceptives as well.
Thanks a lot, Sarah, for highlighting that. Can move to Kazuko.
Thank you. As the poll says, I think the stigma is also a really big problem in Japan, but as it shows, I think the biggest problem can be the lack of information, because, for example, when I take the example of demanding the options of contraception in Japan, as I said, we don't have the implant, the mini pill, patch, vaginal ring, injection. Those are all not available in Japan. And then like I asked, for example, the pharmaceutical company, like, why don't we have? And then their answer was that we don't see any demand and we don't see any market. But then when we try to see the reason why, that's because people don't know the existence of it, including the doctors, medical doctors. And if we don't know, it's impossible to demand, you know? But then I think it's not maybe innovative way as a solution, but since I started telling all the options in social media, now that we got more than 40,000 online signatures demanding all the options. So, and I feel that people's eyes are opening. So I think, and it's the same thing can be said for the abortion pill. We don't have abortion pill and only surgery is available, but then we have no idea that there is an existence of abortion pill, and then it's impossible to demand. So I think it's really important to raise the awareness of that and keep working on it. Thank you.
Thanks a lot, Kazuko. Lilibet can add.
For me, I do have to strongly agree with Sarah and Kazuko. I feel like when we talk about information, there's just so many layers to this onion. I think for Kazuko, it's about having people not knowing the options. You know, for some other people, it's about not knowing what the side effects are or how they can be used or how they're important. And then for people like us in Uganda, oftentimes it's about having, you know, like what is your right source of information? Because we know that contraceptives are out there, but also young people have the mentality that they're only for the adult population, you know, like the parents and, you know, everyone who's legally having sex is the one who's supposed to have access to contraception. So I think the onion layer that is information and access to information goes deeply, but for me that is one of the most outstanding, because with information comes power. There's also the lack of the right information. So a lot of myths and misconceptions are coming up just because people don't know what is right and what is wrong. So that means we even have adults, the adult community, sorry for the air quotes, but yes, the adult community failing to offer the services for young people, because they have been raised and they have learned and they know that contraception are for adults, you know, and they shouldn't be given to young people under the threat that probably if you offer them the information or the service, then it will automatically lead them to be like a signpost, like sex this way, you know. So for me, I think information has to be the very major problem for me. Thank you.
Yeah, thanks a lot, Lilibet. Melissa, is it different in Brazil? What can you add?
It is definitely not different in Brazil. Here, we also struggle with the access to the right information. Typically, Brazilian people believe that condoms and birth control are the only contraceptive options. And you can only get through our public healthcare system condoms for free, and that also difficultates the access to contraception because it is not quite cheap to buy birth control or get an IUD or things as such. Another thing that I also think that is major issue of why we have such high pregnancy rates and things like such, and even ICGs rates, is because there is no SRHR education in schools, and that leads to girls being scared of knowing their own bodies, knowing their options. And one of the solutions that my organization does is hosting roundtables with other activists and even partnership with the government. And we're trying to implement a comprehensive SRHR curriculum in schools in Rio de Janeiro, which is my hometown. And another thing that I also see a lot here in Brazil is stigmas from providers, because depending on your age, race, or social class, they're going to question why you want contraception in the first place, if you're not too young for it, or things as such. It is really complicated, but I believe those are the main two issues we face in Brazil.
Yeah, thanks a lot, Melissa. Just to circle back on COVID-19, what has been your experience as young leaders, and what adaptations are you implementing in your communities? You can have Lilibet chime in.
Yeah, so of course, COVID has created new and eventful challenges, especially in the field of sexual and reproductive health. But I feel that what we do is to reach out to young people where they are. So we reach out to those that are out of school in communities and those that are in school, because those are kind of the properly organized areas that you can get young people, big numbers of young people taking up the different types of information that they have been yearning to find out about. So for us, with the barrier of COVID-19, we then have to this day that the schools are closed, you know, we're slowly transitioning into remote learning, but that only has a particular reach, given that there's probably a young girl who's deep in the village who has very little access to electricity, leave alone the internet. Communities as far as public health ambassadors Uganda, we're trying to reach out and have more strategies and more approaches that are reaching out to young people in communities. So that means that we also know, first of all, that young people don't live in bubbles. So you can preach to this young person all you want, but if they are going to go home and probably be forced to reject whatever you've told them, or to doubt the information that has been given, then you're not really doing much. So for us, we do take a wider community approach to reach out to not only young people, but also their communities and those gatekeepers within the communities that can help us to preach, should I say. When we're working with young people, we work with fellow young peoples, their fellow young people, like, you know, peer educators and young advocates. We do try to grow the capacity of those young people within the community, because at the end of the day, I'll have to leave, but they live there. So they can be able to grow their community information. Yes?
A little bit, you're losing you a bit, but
sorry.
Thanks a lot. I think we are losing you a bit. As you adjust the system, we can hear more also from Sarah. Has it been different in US?
Yeah, so I will jump off what Lilibet said. You know, with COVID-19, we had obviously very big concerns with schools being closed, because this means youth might not have access not only just to quality comprehensive sex ed, but also to maybe their school-based health centers where they might, be able to get contraception. So I personally switched to teaching sex ed virtually, which brought its own issues. And as Lilibet said, it's important to keep in mind the equity considerations there. Not everyone has equal access to a computer and internet connectivity, and that's really important, because we don't want to leave anyone behind in receiving that quality sex ed. But as far as remaining positive, I have seen how going virtual kind of created this new space for young people to be more engaged. The reality is young people are already on the internet and using it as one of their main sources of information. And when we talk about sex in a classroom, there's obviously, it's a very stigmatized topic. And so sometimes there is that discomfort and, around peers. So I felt like a virtual platform allowed students to be a little more comfortable and to maybe turn off their camera and ask questions anonymously and authentically. So there were both barriers and downsides, and there have been some different ways that people are innovating solutions to COVID-19 that I hope we will continue those conversations we're having anonymously via the internet as we move out of the pandemic as well.
Thanks, Sarah, for sharing the adaptations you're having and the barriers in the US. We'll now move to another issue. We find that about 50% of the population is under 30 years. In Africa, is even about 70% of the population is under 30. And a report in 2018 indicated the age of the head of states was about 64 years. The leaders are older. The young are not being involved. What can we do to involve youth genuinely so that we build solutions together and the youth are partners, so that as we move forward, we are moving forward together? Maybe just to pose a question to Kazuko, where are intergenerational conversations and co-leadership of value? What are they? And do you have any examples of successes that you'd like to highlight, Kazuko?
Thank you so much for this important question. I really believe that intergenerational conversations are important because otherwise crucial matters that minorities face are easily missed or ignored. When we see the Japanese situation, for example, like in whole Japan, we have only less than 1% of politicians who are in 20s. And also when we see the national politics, for example, we have almost around 10% of female politicians in the national government. So for example, young women are really minority in decision makers in Japan. And actually one thing I think missed when we talk about the barriers to contraception, it's not only about information, but also a cost. Because, for example, in Japan, contraceptive pill can cost $20 or $40 per month. Emergency contraception can be $100 to $300. And for abortion, it can be $1,000 to $2,000. So even if the young people can know about that, they cannot access it because as long as it can cost like that. But then when we see the national health insurance in Japan, but many Japanese politicians say we have such a inclusive, perfect national insurance. Maybe it is because it's relatively cheap as long as it's covered by the national insurance. But all those women's health care, including contraception or abortion, pregnancy, those are not covered at all. I feel that it's one result that we don't have the diversity in decision makers. But then I want to bring up the positive example that we brought. As I said, now I'm really working on the access to emergency contraception. because it's not available in pharmacy and can cost $100, $300. But then last year, the government tried to create the next 5 years plan for gender equality policies. And then for the first time, they really try to have a space for young people to raise our voice up. So like one of my friend activists, she collected a lot of voices from young people, more than like thousands of young people voices. And then like when they look those opinions, they realize that so many people mentioned about emergency contraception. And also we do the online petitions, which collected more than 110,000 voices. And then like when they see those voices, they put the sentence saying that we will consider the possibility of putting emergency contraception in pharmacy like next 5 years in the sentence after thinking about young people's voices. So I think, and then like we really welcoming this positive reaction towards that. So I think, you know, like this, once they can include our voices, they really can make a better changes that can bring the benefit for young people or women, like minorities. So that's the reason why I really believe that diversity in decision maker, including the generational diversity, are really important. Thank you.
Thanks a lot, Kazuko. We'll now ask the audience. We'll conduct a small poll just to also hear from the audience. What do young leaders need from decision makers to ensure the success of the solutions? We talked earlier about accountability. What do we really need? Thank you. Kindly take 1 or 2 minutes. Yeah, thank you. So from the poll, financial support for solutions is the most suggested. And then we have opportunity to speak about work. We also have allies at decision-making levels. Thanks a lot for participation. Maybe just to add to what the audience has said and what Kazuko said earlier. Sarah, can you tell us what we look to driving action and inclusion of young leaders in decision making?
Absolutely. You know, I think that as young leaders, where I feel most heard has been among adults who make an intentional effort to break down that generational wall. So I have a professor who comes to mind who makes a point to call us all his colleagues and reminds us that while we're there to learn from him, he is also there to learn from us too. And I know that sounds small, but from my perspective, it really makes a big difference. I think if all adults approached conversation that way with young adults, just as much to learn as to teach, we would get a lot further in innovating new solutions.
Thanks a lot, Sarah. And as young leaders, you have solutions. And at times, you can imagine if you are president or We love all that financial support we've talked about, all those allies we've talked about. What will you do to ensure young people's voices are heard, particularly when concerning access to services they need? We can start with you, Sarah.
Yeah, absolutely. If I was president, I would want, as we've discussed, and as Siva said at the beginning, I would want youth engagement to be more than procedural. I would really want it to be meaningful. And so I think to do that as an adult, I think an adult leader has to be willing and motivated to work with young people from marginalized communities. And you have to make that commitment to having uncomfortable conversations. I would really try to prioritize lived experiences and the value those bring. I think a lot of times we focus so much on how long we've been in school or the jobs we've had. And I think that can be relevant when we're just talking about what we've really experienced in life and what that offers too. So as president, I would be open and willing to think about things differently. And most importantly, I would be willing to ask for help. And I think that's a big one. I would ask young people for help.
Thanks a lot, Sarah. We'll move to Melissa, your president, and what will you do? Thank you.
Yes. In Brazil, I believe there is a major wall between public service and nonprofits and activists. So even though people go to the streets and they do march and protest, the government usually ignores those voices and suppresses them. So I feel like being president, your role is to listen to your people and listen to especially young voices. And one way of doing that is actually ensuring that you have an agenda that connects with the issues that young people are facing, the issues young people are advocating for. In my hometown, their town hall has a secretariat for youth, which is basically a person who is responsible for overseeing all kinds of youth-related topics. And I feel like that's something I would do as a president on a federal level, because otherwise we just can't move on. You can move on if you are not having those awkward conversations and ensuring that all people have access to their rights. And yeah, thank you.
Thanks, Melissa. Lilibet.
Building off President Melissa and President Sarah's point, I think for me, a major point would be to offer young people platforms to express themselves, but not just for us to have the information shared and hanging, but to also ensure that that information, once it has been shared, is then utilized and incorporated within the different structures and systems, so that overall young people are actually taking the lead in designing and delivering the different interventions that they want.
Thanks, Lilibet. Go to Kozuka.
Thank you. If I was a president, I want to set the regulation pursuing affirmative action to ensure equality over gender, age, people with disability, all kinds of diversity in all levels of society, especially in decision-making process and also implementation process of policies. But before finishing it, I really want to emphasize that it's really not enough just to listen to young people, but I really believe that young people should be in the decision-making process, should be in the table. Thank you.
Thanks a lot, Kazuko. We'll now move to, we encourage the audience to also send in and the questions or anything you want to highlight in the Q&A. So just to look at the some of the questions which have been asked, and I'll post them to our panelists. Just a minute. For Kazuko, there's a question for you. have you faced any pushback as you've been sharing more information about contraceptive that's available? If so, how have you overcome that? Thank you.
Thank you. Actually, I got a lot of pushback, of course. I got on the social media, for example, I got a lot of like negative comments saying that why should we spend the resources on people who are having sex for fun, or not for having baby, and also when we think about advocacy work, unfortunately, one of the biggest barrier we have is the group of obstetricians and gynecologists. They are the one who really try to stop the access of contraception or safe abortion, which is really sad. But to overcome it, I really believe that this is just the essential human rights and essential healthcare, not more than that. And if you can really believe it from your heart that I just demand something should be ensured as a human rights and healthcare, then you can be really strong and can really overcome, I really believe. Thank you.
Thank you. I'll open it to the other panelists. Anyone who's who faced any pushback, to share the experiences and how they overcame that.
Sorry, and also it's really useful to use the resources from WHO or those international organizations. Sorry, thank you.
Okay, thanks a lot, Kozuko.
I think my favorite saying I ever heard was when someone once said, giving condoms to kids is more likely to make them have sex, which is not true, and the evidence does not show that. And I remember I heard someone respond and they said, giving a child a condom, would you say the same thing about putting a seatbelt on your child in the car? It doesn't make them get into a car accident. It just helps in the case that they do, right? It's going to protect them. And I think that's the way we should think about contraception too.
Thanks a lot, Sarah. Pose this next question to Melissa. When working with the Youth Secretariat, have you found that there are best practices in working together as partners?
Yes, definitely. I think one of the best practices is actually practicing active listening. Maybe this is a Brazilian thing, I don't know. But usually when we're having those difficult conversations, you usually have a lot to say and you're not actively listening to what the other side also has to say. So ensuring that we're having both sides to create inclusive solutions. And let me see if there's anything else. And also really nice friend to create long-term changes. But I'd say that my experience working with the Young Secretariat has been like very active listening, just sitting down and listening to what each other has to say and finding the middle path to achieve our goals. Thank you.
Thanks, Melissa, for those insights. Move to the next question for Pauline. Have there been any times when you've lost motivation in your work? If so, how did you find continued motivation? Thank you.
Hi, Al.
Pauline,
hear you.
can't hear you. Can let me.
Okay, Al. Thank you so much, Al. Like you said, Al, sometimes, especially for us as young people working at the grassroots level, many days, sometimes I try to get frustrated and sometimes I just like, I need to cover because looking at the story on how we established Girls of Alliance with a few of my colleagues in 2019, and then in 2020, we register office space, legally register, but 2019 up to now, we do not have even a single grant yet, but yet we are still working and committed to our work. So sometimes I feel like I just need to shout this office down, maybe find something else to do, and sometimes all of us who are volunteering, they say, sometimes I think we just need to close this space for a month, but we'll continue to do it. But many days, sometimes, yes, I get frustrated on this journey, and I feel like I just need to cut this thing off. But again, one thing that keeps me going is when I come at office and see the many volunteers and the many young people out there who are committed to this cause, and then I get motivated to keep going.
Thanks a lot, Pauline, for that very useful advice and also motivation for the young leaders. I know you're pressed for time, and I will wish to conclude this panel discussion by thanking the young leaders in providing us with the excellent insights on the questions. As you've heard, they've debunked the myth that young leaders are tomorrow's leaders, but they are true to the hashtag, the next generation is now. So we need to partner with the young leaders so that we can move forward, because it's the future of the young leaders that you are shaping with the policies that you are enacting now. So they need to be at the table. Thank you. I'll hand over to Shailene to close.
Thank you so much, Charles, and thank you to all of our fantastic young leader panelists. It's so good to hear from you. It's been so wonderful to be connected with you and hear more about your stories and the solutions that you're driving. I'm really excited to continue to see the fantastic work that you're all doing. And thank you so much to all of our attendees who participated in the conversation today. We love hearing from you. After this event, you can expect a follow-up email from us that has more information about all of the work that the young leaders are doing, as well as opportunities for you to get involved yourself for our young leaders who are also participating by listening in today, as well as for other organizations who would like to work with us and our fabulous partners, Women Deliver, Girl Up, and the Guttmacher Institute. So thank you all so much for attending. We're ending right on time, and I hope you all have a wonderful rest of your Tuesday. Thank you.
Thank you.